Bismillahirrahmanirrahim. Quote of the day: Allah will never leave you empty. He will replace everything you have lost. If He asks you to put something down, it's because He wants you to pick up something greater. Assalamu alaikum. I am Dr. Hussain Mahmood. Today I am presenting on ANCOVA Analysis under kind supervision of my professor Dr. Saira Afzal. Learning outlines. Today we learn what is variance, what is confounder, what is covariant, introduction to ANCOVA, assumptions of ANCOVA test, application, usage of ANCOVA, recent updates, and multiple choice questions. Learning outcomes. Today we'll learn about variance, confounder, covariance, introduction to ANCOVA, assumptions of ANCOVA test, and application of ANCOVA. What is variance? The term variance refers to a statistical measurement of the spread between numbers in a dataset. More specifically, variance measures how far each number in the set in form of means. In particular, it measures the degree of dispersion of data around the sample means. Analysis of variance, ANOVA. An ANOVA test is a type of statistical test used to determine if there is a statistically significant difference between three or more independent groups by testing for differences of mean using the variances. What is confounder? A confounder is a factor other than the one being studied that it associated both with the disease-dependent variable and with the factor being studied independent variable. A confounding variable may distort or mask the effect of another variable on the disease in question. What is covariant? A continuous variable that exists naturally within the research unit and it's not part of the main experimental manipulation but has an effect on the dependent variable leading to effect on the study outcome. For example, a hypothesis that coffee drinkers have more heart disease than non-coffee drinkers may be influenced by another factor. Coffee drinkers may smoke more cigarettes than non-coffee drinkers. So smoking is a confounding variable in the study of the association between coffee drinking and heart disease. The increase in the heart disease may be due to the smoking and not to the coffee. Another example, so the same example, if hypertension is also considered, then this heart disease can be due to chronic hypertension, as hypertension is directly affecting the dependent variable, but it is not of primary interest. It will be called as covariant. Introduction and assumption of ANOVA. ANOVA plus covariant is equal to ANCOVA. Introduction of ANCOVA and ANOVA plus covariant is equal to ANCOVA. Analysis of covariance. ANCOVA provides a way of statistically controlling the linear effect of variable one does not want to examine in a study. These extraneous confounding variables are called covariants. ANOVA means we compare the values of different group in mean of different groups. But in ANCOVA, we adjusts the mean value of different groups and then they compare the values. ANCOVA. An ANCOVA is an extension of an ANOVA in which we would like to determine if there is a statistically significant difference between three or more independent groups after accounting for one or more covariates. ANCOVA is also an extension of multiple regression. For example, a study was conducted in which three different drugs were given to three different groups and life expectancy were considered the dependent variable. Applying all the assumption ANOVA will be used to check the statistically significant difference among their means. But if the hypertension is considered as covariant variable, then the ANCOVA test will be used because hypertension can also affect the life expectancy along with these drugs. As extension of ANOVA, As an extension of ANOVA, ANCOVA can be used in two ways. To control for covariant typical continuous or variable on a particular scale that aren't the main focus of your study. To study combination of categorical and continuous variable or variable on a scale as predictors. In this case, the covariant is variable of interest as opposed to one of you want to control for. For example, in a study to tell the effect of antihypertensive drug on systolic blood pressure in participants of varying age, the change in systolic blood pressure after treatment, a continuous variable is dependent variable, and the independent variable might be age, and the treatment will be categorical variable. Within group variance, ANCOVA can explain within the group variance, it takes the unexplained variance from the ANOVA test and the tries to explain them with confounding variable. You can use multiple possible covariant, however, moreover you enter the fewer degree of freedom you will have. Entering a weak covariant isn't a good idea. It will reduce the statistical power. ANCOVA as extension of linear regression. ANCOVA, when used as an extension of multiple regression, ANCOVA can test all the regression line to see which have different y-intercepts as long as slopes for all line are equal. Like regression analysis, ANCOVA enables you to look at how an independent variable act on an dependent variable. ANCOVA removes any effect of covariant which are variable you don't want to study. For example, you might want to find the new drugs work for depression. The study has 3 treatment and groups and the 1 control group. A regular ANCOVA can tell you if treatment work, but ANCOVA can control for other factors that might influence the outcomes. For example, family life, job status, or drug use. Assumptions of ANCOVA test. Independent variable minimum of 2 should be categorical variable. The dependent variable and covariant should be continuous variable measured on interval scale or ratio scale. Third assumption is make sure observation are independent. In other words, don't put people into more than one groups. First, in normality, the independent variable should be roughly normal for each of category independent variable. Data should be show homogeneity of variance. The covariant and dependent variable at each level of independent variable should be linearly related. Your data should homozygotic of y for each value of x. The covariant and the independent variable shouldn't interact. The other words, they should homogeneity of regression slopes. Application usage of ANCOVA. Combine the principle of ANCOVA with the principle of regression. A chief advantage of this technique is that, in contrast to ANOVA, the independent variable can be any data level. In other words, one of the chief proposals is to eliminate systematic bias. Suppose two groups of patients has unequal number of swollen joints at baseline. Even through the study, you may have randomized. The initial number of swollen joint is used as the covariant, and ANCOVA adjusts the post-treatment means of the group to what they would have been if all groups had started out equally on the covariant. ANCOVA is to educate the within groups variances, is to reduce the within group variances. Suppose a clinical trial investigates the effect of the ESR of a biological agent that and an active comparator subject are randomly assigned to receive one of the other treatment and the change in ESR is observed. Within each treatment group, there is a considerable variant in ESR reflecting individual differencing among patients in the degree of active inflammation. ESR and active inflammation are covariates. If one could statistically remove this part of the within group variability by allowing the degree of inflammation to the covariant in the analysis, a smaller error term would result and test would be gain power. Now one-way ANCOVA. One-way ANCOVA is extension of one-way ANOVA. In one-way ANOVA, don't adjust the covariant. Where is one-way ANCOVA? We adjust at least one covariant. The one-way ANCOVA test find out whether the independent variable still influences the dependent variable after the influence of covariance has been removed or adjusted. In this test, one continuous dependent variable, one categorical independent variable, and at least one continuous variable for removing its effect adjusted are used. For example, 20 patient diastolic blood pressure at 30 minutes are given. One-way ANCOVA test was used to compare the mean diastolic blood pressure in three age groups. Independent variable after adjusting the effect of baseline diastolic blood pressure, which was found to be statistically significant. As Levine test for homogeneity was significant, p-value 0.601 resultant bone-Ferroni test was used for multiple comparison, which showed that diastolic blood pressure was significantly different between one pair. Age group of less than 30 to 50, less than more than 50, p-value is 0.031 and insignificant between rest two pairs. Less than 30 to 30 to 50 and 30 to 50 to more than 50, p-value is 0.05. One-way repeated Mayer ANOVA. One-way repeated Mayer ANCOVA is the extension of one-way repeated Mayer ANOVA. In one-way repeated Mayer ANOVA, we don't adjust the covariant, whereas the one-way repeated Mayer ANOVA we adjust at least one covariant. Thus, the one-way repeated Mayer ANCOVA is used to test whether mean are still statistically equal or different among after adjusting the effect of covariant. Example, this chart shows the different student using different aesthetic technique, and they collect first current beauty scores before the using aesthetic technique, and then after using technique they collect the score. After applying ANCOVA through SPSS, aesthetic techniques p-value is 0.03155 and current grade is p-value is 0.7539, which is more than 0.05 and significant. The p-value for aesthetic technique is 0.03155. Since this value is less than 0.05, we can reject the null hypothesis that each of the aesthetic technique leads the same average beauty score, even after accounting for the student current beauty grades. Now it's time for recent advances. An article, A New Cheyne's Approach to Case of Heterogeneity of Regression Slope in ANCOVA. In this study, when the assumptions of linearity and homogeneity of regression slope of conventional ANCOVA are not met, a new approach named Cheyne has been suggested to use conventional ANCOVA instead of robust or nonlinear ANCOVA. The proposed Cheyne approach involves the transformation of continuous covariant into a categorical structure where the relationship between the covariant and dependent variable is non-linear and the regression slope are not homogeneous. A simulated data set was used to explain Cheyne approach. In this approach, we performed conventional ANCOVA in each subgroup, which is constituted according to knot values and analyzed of variances with two-factor model. After Mars method was used to categorize of covariants. The first model is a simpler model than the second model that include interaction them. term. Since the model within the interaction effect has more subject, the power of test also increase. The rest of existing significant difference is revealed better. We can say linearity and homogeneity of regression slopes are not probable of data analysis by conventional linear ANCOVA model. By helping this approach, it can be used fast and efficiently for the presence of one or more covariants. This is another article published in 2025, critic of enhanced power claim for quasi ANCOVA and dual-centered ANCOVA. Two related methods, quasi ANCOVA and dual-centered ANCOVA, have recently been suggested as a way to get greater power when analyzing data from before and after study. Both methods use group means centering, where the groups are the treatment of comparing sons groups, comparison groups. Group mean centering creates a generated regress problem when the estimated standard errors are corrected. For the generated regression problem, there is no longer any gain in low power. The corrected quasi ANCOVA estimated are identical to those from ANCOVA, and the corrected dual-centered ANCOVA estimated are identical to those from the different models. These conclusions are driven analytically and also verified using a Monte Carlo simulations. Now it's time for MCQs. First MCQ. A researcher did a study on COPD. After collecting the data and upon analysis, he came to know that there is a dispersion of data around the sample mean. The statistical measures of this spread is called as variance, covariance, means, mode, and median.
A. Variance.
Yes, it's A. Yes, it's A. A quasi experimental study was conducted by Qasim. In this study, he observed a variable which is affecting both the dependent and independent variable, leading to affecting outcomes. What is the variable? This will be called variate, covariate, confounder, dependent variable, and independent variable.
C. Confounder.
C.
Yes, it's C. Confounder. Ali is doing a non-RCT about the effect of drugs on the hypertension considering the age of the patient. ANCOVA test is used to analyze the data after applying all the assumptions. In this very case, age is considered as covariate variable, dependent variable, independent variable, nominal variable, ordinal variable.
Dependent. B.
B.
No, it's A, covariate. Yes, it's covariant variable. A study was done in which different eye colors like blue, brown, and green groups are and tendency of glaucoma is observed. In the sample, patient also gave family history of glaucoma. Which of the following tests will be used to measure the significant difference of measures of group? ANCOVA test, T test, ANCOVA test, F test, and chi-square test.
C. ANCOVA.
Yes, ANCOVA.
Yes, it's C, ANCOVA. A student did a study on a gender, male, female, and transgender, and the presence of diabetes, yes, no, with the age as a covariant. His supervisor told him that he cannot use the ANCOVA test. Why ANCOVA test cannot be used to analyze the data in this case? The independent variable is continuous. The dependent variable is categorical. The dependent variable is continuous. The covariant is continuous. The independent variable is categorical. It's B.
B, the dependent variable is categorical.
Yes, it's B. The dependent variable is categorical. The test, the effect, to test the effect of antihypertensive drug on diastolic blood pressure in participant of varying age. ANCOVA test will be used to analyze the data. Why an ANCOVA test will be used in this case to measure the standard deviation, to eliminate the effect of covariant, to enhance the effect of covariant, to measure the mode, and to measure the median.
D.
B.
Exactly to
B.
Yes, it's B, to eliminate the effect of covariant. A researcher did a study and was rejected in the board, but after eliminating the effect of covariant, his study got approved. How did the removal of covariant effect increase the worth of study? By increase the effect of covariance, by increasing the power of statistical test, by decreasing the power of statistical test, to test change the dependent variable to categorical variable, test change the independent variable to nominal variable.
B, by increasing the
Yes,
power of the test.
yes, it's B, by increasing the power of statistical test. A researcher did a study. In the study, the covariant was in continuous data. The observation in each group was independent. The data was not normally distributed. There was no extreme outlier in any groups. And ANCOVA test cannot be used in this study because the covariant was in continuous data. The observations of each group was independent. The data was not normally distributed. Variables was homogeneous in each group. The covariant was in categorical data. Let's see.
Okay, so it's continuous, so it's in the
Data was not
categorical.
normally distributed. In an ANCOVA study, life expectancy is the dependent variable, treatment type is the independent variable, and the hypertension is a covariant. What is the goal of ANCOVA test here? To adjust the effect of hypertension, to reduce the sample size, to eliminate treatment differences, to increase variances, to test for heterogeneity. It's A, to adjust the effect of hypertension. In a trial comparing depression treatment, researchers noticed that participants have varying level of job stress. They believe job stress influence recovery, but it is not part of the treatment. What role does job stress play in this study? Independent variable, dependent variable, confounder, covariate, and moderator.
Confounder. C.
It's covariate. It's D. This is key for our MCQs. This is our YouTube channel. Kindly like and subscribe. Thank you.